Hello, I'm Catherine Frederico.
And I'm Jain.
We're here today to talk to you about Y-Tech. It's a primer on nutrition technology.
This is the first in a series of presentations on how dietitians can incorporate technology into their practice.
The learning objectives for this program include being able to understand the importance of the confluence of policy, technology, and societal adoption on nutrition practice, being able to differentiate types of nutrition technologies, elucidate nutrition tech research findings, and leverage telehealth in a nutrition practice.
The program will include a brief dietetic flashback, explanation of digital health policy, an introduction to health technology, big data, patient engagement, health sites, devices, gadgets, apps, health games, EHRs, and telehealth. Our goal is that through this webinar, you understand how technology and policy have evolved in recent years to change the way that dietitians practice, and also understand the technology available to you as you practice care. Before we begin, a couple of disclosures. I, Jain, am a co-founder of the web-based electronic health record and telehealth platform Healthy. Healthy owns its companion mobile app.
As for myself, Catherine Frederico, my disclosures include being president of Frederico Arts LLC and having consulted on the app Max's Plate for Max on Snacks. I am the author of, and Frederico Arts LLC is owner of the ebook An App a Day and apps Veggie Garden Palooza and Food Focused Fruits. It also owns copyright of nutritionvision.info and appyliving.com. This is a 1928 photo of the diet kitchen at Walter Reed General Hospital. Note the chic, long lab coats. Dietitians wore caps with blue ribbons to differentiate them from nurses. When speaking about nutrition technology, I often wonder what these early practitioners would think of dietetic practice in the 21st century. I think they would be amazed.
For years, the dietitian's toolbox has consisted of food labels, food models, paper food diaries, diet history forms, handouts, recipes, seasoning charts, kitchen measuring tools, and food and body scales.
Many people forget that it was President George W. Bush who gave the first executive order in 2004 to digitize medical records. He also ordered the creation of the Office of the National Coordinator, or ONC, which manages federal digital health initiatives within the U.S. Department of Health and Human Services. In 2005, the American Medical Informatics Association began training doctors and nurses. President Obama was inaugurated in 2007, and the iPhone came to market. In an insightful move, the Academy formed a nutrition informatics work group. In 2009, Congress passed the American Recovery and Reinvestment Act, as well as the High-Tech Act, which finally infused the Electronic Health Record, or EHR, program with $26 billion to jumpstart their use strategy. Apple's App Store opened in 2010, and the Google Android phone and App Store opened in 2011.
Rapid global societal adoption of personal technology, coupled with government policies, was a golden triad of forces rushing the adoption of EHRs, as well as other smart health devices and apps. As of 2016, the global population census stands at about 7.2 billion people. 6.9 billion of these people have mobile phones, and 1.9 billion have smartphones. According to the May 2016 Mobile Health News, about 72% of Americans have smartphones.
3 stages of meaningful use are described in the High-Tech Act. Stage 1 began in 2010 and mandated that eligible practitioners or physicians and medical facilities establish methods to digitally capture patient data for an electronic medical record. It also required that a small percentage of patients be able to receive and send data to the record. Stage 2 required more clinical additions to the record and more patient engagement. Stage 3 focuses on outcome and data interoperability.
Which of these do you think is the most efficient and beneficial way to collect and store patient medical information? In which can data be easily aggregated and disseminated as needed? In which can de-identified data be studied for population health research purposes to discover best practices? The answer is, of course, the digital medical record, right? For decades, medical records have been siloed into paper stacks that did not lend themselves to easy data collection and comparison analysis. This changes with digital health.
Welcome to the future of healthcare.
Through the confluence of technology, rapid societal adoption, and multiple federal health policies, our plain vanilla healthcare system has transformed into digital healthcare. You may hear it referred to as e-health, i-health, m-health, wireless health, electronic health, connected health, health 2.0, or even the terms telehealth or patient-centered medical homes. But most often, it's called digital health.
As well as lower costs. Other benefits of digital healthcare include efficiency, mobile access, data analysis, improved communication, and better patient engagement and control.
In the new era of digital health, personal medical data aims to be controlled by the patient. Patients get to choose their means of data collection and communications. Patients are becoming more adept at using computers, smart devices, and sensors to manage their health.
Patients are also in control of who sees, stores, sends, or receives their medical data, whether it be providers, family members, or caregivers.
The term big data is used to describe the types of information that's now capable of being digitally collected, stored, and analyzed in real time for population healthcare best practice determinations. For example, analysis of large genetic databases is getting better at finding the best combinations of drugs, diet, and treatment for management of some diseases. This is much preferred to hiding data away in thousands of doctors' offices and waiting for multi-year research trials to simulate conditions and then wait for journal publication.
Over the past 6 years, I have attended many digital health conferences. Ever since the first bit of patient-generated data, doctors and nurses have said that they don't have the time to review it. A doctor shortage exists, especially in many rural areas, and nurses already have dozens of alarms to attend. So who wants all that tracker data?
Dietitians. Registered dietitians are the missing piece to this puzzle. Dietitians have always been concerned with nutrients and calories in and nutrients and calories out in both wellness and disease challenges. They have 4-year degrees in human health science, take more nutrition courses than the majority of doctors and nurses, complete required internships, and like doctors and nurses, are licensed or certified in most U.S. states. Even before the advent of digital health devices and apps, registered dietitians have been requesting, collecting, and assessing bioanalytics on which to base their advice and create patient plans. The Academy has had an evidence analysis library for years. Wellness and clinical dietitians are trusted patient care team members. They have the skill base, the interest, and the time. It is an everyday part of the profession.
A recent 2016 ONC report found that nearly all private U.S. hospitals were using certified EHRs. 33% of consumers use health apps. 49% of Americans own at least one wearable device. And 35 to 49-year-olds are most likely to own a smartwatch. These numbers are steadily increasing as healthcare and nutrition professionals and consumers discover the benefits of health technologies.
In 2015, IMS Health studied the health app availability and determined that there were about nearly 165,000 different apps available. In early 2016, the Consumer Health Informatics Work Group of the Academy of Nutrition and Dietetics scanned the landscape of smart devices of interest to nutrition professionals, and they found 195 different tools. Health technology innovations are rapidly expanding, spurred by university programs and venture capital support.
So are you up to speed on nutrition technology and digital health? Technology is very broad, and now we are going to walk you through the different types available for use by dietitians and their clients.
The first class of technology available to dietitians and their patients are computer websites. Here, patients can be guided to appropriate websites, health articles, patient blogs, symptom checks, PDF ebooks, clinical pages, government health statistics, and travel information using their computers.
Even health records can be accessed by computer using functionality from platforms like bluebutton.gov or hospital EHRs.
Now we move on to smart devices. A 2016 scan of the smart health device landscape by the Consumer Health Informatics Workgroup of the Academy of Nutrition and Dietetic quickly discovered 195 smart devices in 14 categories of interest to nutrition professionals.
For example, Withings and iHealth make digital blood pressure cuffs that offer app connectivity for readings, data storage, and sharing.
Next is kitchen gadgets. Kickstarter has been the scene of many smart devices that relate to the kitchen. These include smart plates, cups, forks, and scales, just to name a few.
For example, the Prep Pad scale connects to an iPad, which can visually display amounts and a nutrient analysis of ingredients, recipes, and meals.
Now, onto the apps. The Apple and Android app stores have thousands of apps that can be used to engage with nutrition. These vary in capability from being used as tracking tools to digital educational resources to health games and even useful QR code links. We recommend visiting appyliving.com, where you will find an app-a-day ebooks, which are comprehensive directories that profile hundreds of apps of particular interest to dietitians and consumers.
NutriCare Tools is a health app created by the Academy of Nutrition and Dietetics. Its information is evidence-based, contains calculators, a unit converter, functionality for meal planning, multiple images, and references.
Health games have been proven to be an effective and beneficial way to affect behavior change for individuals. They have also been incorporated into bedside programs at children's hospitals. One of the first fruitful game studies that had wonderful success was the 1997 Packy and Marlin game for adolescents with diabetes. It showed participants had better glucose control, reduced visits to emergency rooms, and improved parental communication.
Veggie Garden Palooza is an example of an engaging app game for players of a wide age range to identify over 100 vegetables. It seamlessly connects scores to the game center and provides users an idea of how to incorporate vegetables into their daily diets.
There are nearly 20 options of telehealth platforms for use by dietitians, particularly those in private practice. Each platform offers an array of functions from which to choose that suit your particular needs, whether it be for wellness coaching or medical nutrition therapy. For example, functionality can include features such as structured charting, secure messaging, consumer interaction, or even in a companion app.
These EHRs are used by dietitian nutritionists who work in their own office or in private community or hospital outpatient clinics for corporate wellness programs, virtual visits, and remote patient monitoring.
One example of an EHR available on the market today is Healthy, which is an all-in-one telehealth platform and management software for dietitians and patients. Through the web and mobile interfaces, dietitians can improve their productivity with billing support and auto-scheduling, better connect with patients through messaging and secure video conferencing, and quickly share documents like recipes and meal plans. Dietitians will also benefit from increased patient engagements through tools available for patients to track their food, their workouts, and key health metrics. The goal of tools like Healthy is to simplify the workflow of dietitians as they see patients.
Digital health tools are available for all Academy areas of practice, including business, clinical, community, education, food, and research. Click on the link here to check out Catherine Frederico's YouTube video of ways she has used nutrition informatics in multiple areas of practice.
The takeaway: use technology. Wherever you are, however you practice, technology will meet you there. Whether you've been practicing for 30 years or 30 days, you should be using technology in a way such that it works for you and your clients.
So how can you get started? First, start small. Download and familiarize yourself with a couple health apps, or purchase a small, smart device and explore its functionality. Think about what works for the demographic of clients you work with. If it's helpful, seek a business coach. They can guide you in officially setting up your practice, marketing services, and organize your workflow. Use existing resources to help you choose the right type of tool for the right client. Finally, we're putting together deep dives on the tools available specifically for dietitians, which should give you some great inspiration on how to build your personalized digital health toolbox.
We hope that you enjoyed this presentation and that it's been helpful in giving you an overview of how technology is changing the way dietitians practice and the different types of technology available. We hope you walk away today excited about incorporating technology into your care, no matter what setting you practice in and the types of patients that you work with. Also, stay tuned for future presentations where we dive deeper into categories of technology available. In the meantime, please feel free to connect with us if you have any questions. We'd love to hear from you.
Thanks for listening. We'll see you next time.